Hey there, crisis and trauma students. Here are your session 2 quiz answers with explanations when possible. So, when PTSD-like symptoms appear in the very people who attempt to alleviate the mental and physical suffering of people in crisis, this is known as both compassion fatigue and vicarious traumatization. You can see that here. So this is a screenshot again from your crisis intervention strategies textbook. Complicating the issue, PTSD-like symptoms may appear in the very people who attempt to alleviate the mental and physical suffering of people in crisis and have become known as compassion fatigue, that's from Figley, and vicarious traumatization. That's originally, this is a seminal source, Perlman and Sackvitting. Okay, question 2. The typical kinds of responses that occur immediately after the crisis may give rise to what are called peritraumatic symptoms, immediately following peritraumatic. These are common responses as the mind attempts to reorganize itself and cope with a horrific event. So here's the screenshot. The typical kinds of responses that occur immediately after the crisis may give rise to what are called peritraumatic, meaning around or similar to trauma symptoms. Peri in this case meaning around the time of, like immediately following the trauma. And this says here, for many people, these responses will recede after a few days, which is why, as you'll learn moving forward, if you didn't already know, time is the big distinguishing factor between whether we diagnose a person with acute stress disorder or post-traumatic stress disorder. Because if it's been less than a month, it's acute stress. If it's 1 minute clicking by, right, which moves us to the next day beyond the month, makes the difference to PTSD. So 29 days versus 30 days or what have you. And it's because for a lot of people, peritraumatic symptomology may resolve on its own, especially considering factors that they brought into the trauma, factors contributing to the horror, the horrific level of horror during the trauma, like whether it was like intentionally caused, whether it was caused by humans or some sort of natural disaster, something like that, and then immediately following peritraumatic factors. So question 3, the dissociative symptom in which a person feels like their surroundings are unreal and cannot be happening, or the images become distorted and blurred and are hard to sort out and make sense of. This type of dissociation is called derealization. You can see that here. Dissociation can range from numbing or lack of emotional responsiveness to the event, to derealization, which is the feeling that it's not real, it's like a bad dream, or depersonalization, I'm out of my body looking at this from the grandstand. Question 4, a result of repeated exposure, to traumatic situations that commonly occurs across key developmental stages. This is what makes it complex PTSD, that it happens multiple times over time and that it happens during these key developmental periods when the person's personality is developing. Because when the person's personality and nervous system develops in context of an environment that is characterized by ongoing trauma, then the whole person's personality and nervous system develops around the need to survive. So this is complex PTSD. Let's see. But there is agreement among clinicians that complex PTSD is a result of repeated exposure to traumatic situations, victimization across key developmental stages. Question 5. It is common for those who suffer from complex trauma to have companion diagnoses of anxiety, depression, organic, mental, and substance use disorders. It is quite common. As a matter of fact, it is quite common even for people who have, those other diagnoses to have additional diagnoses, personality disorder diagnoses, comorbid as well. Let's see. So, in fact, it is probably more common to have comorbidity. In other words, the presence of 2 diagnosable disorders such as major depression and substance abuse or substance use disorder together. Question 6. There are a number of risk factors for PTSD. Their effect sizes tend to be small and to vary according to the nature of the trauma. This is very interesting. And this was found by Brew in 2005. Although there are a number of risk factors for PTSD, their effect sizes tend to be small and to vary across the nature of the trauma. In other words, we're talking about a situation, when we're talking about risk factors, that there's a whole wealth of them, and some tend to cluster depending on the nature of the trauma. Question 7. Researchers have found significant decreases in the hippocampal area of the brains of combat veterans and women who experience severe childhood sexual abuse, where explicit memory encoding, memory consolidation, and organization take place. Brenner and Associates and Gervitz found significant decreases in the hippocampal area of the brain. Decreases in the hippocampal area. Question 8. There was a significant decrease in that part of the brain, Broca's area. So this idea of that, so this is Van der Kolk now, right? The body keeps the score. So this idea that there were expected brain changes, but one surprise was this significant decrease in Broca's area. Question 9. The scans also revealed that during flashbacks, our subjects' brains lit up only on the right side. Again, talking about explicit versus implicit memory being more of a right hemispheric phenomenon. So during flashbacks, because the left hemisphere in general tends to store things in logical linear fashion, but in a flashback it feels as if the horror that occurred in the past is occurring in the present, and it's an embodied sense of danger now. Even when the survivor is not in danger now, the brain believes and feels as if it is, and that's not related to that logical linear memory. That is related to that more embodied, spatial, emotional memory. Question 10. The rational brain is basically impotent to talk the emotional brain out of its own reality. Again, because that prefrontal cortex area is offline, and because that logical, rational, linear left hemisphere is not activated. It's the right hemisphere. Question 11. In contrast, those who have been traumatized and subsequently developed PTSD did not modify their accounts. Their memories were preserved essentially intact 45 years after the war ended. In other words, our memory is made, our normal memory is made to sort of change and fall apart over time. And this type of memory remains almost perfectly preserved, as if that memory didn't get tucked into the timeline and had to sit back and sort of decay in a normal way, but instead is like perfectly crystallized. Question 12, the amygdala is like a smoke detector. It detects danger rapidly without logical appraisal of the situation. Question 13, the hippocampus acts like the dongle. It converts short-term memory into long-term memory. Question 14, the medial prefrontal cortex acts like a watchtower, and it downregulates the amygdala. Question 15, the neurochemical adrenaline, also known as epinephrine, is like the motivational speaker in the brain. It gives us the power to fight, speed to flee, and it increases heart rate, elevates blood pressure, and boosts our energy supplies. Question 16, the neurotransmitter cortisol acts like a custodian. It helps regulate cell metabolism, increases glucose in the bloodstream, and alters our immune system responses. Question 17 was about the insula. Question 18 was about implicit memory, and as I've been saying, that's more of a right hemispheric function. Question 19 was about myelin. So extreme trauma causes increased myelination in brain areas associated with memory. In other words, those pathways of that specific memory, that neural pathway, gets stronger, thicker, more myelinated, more automatic for that particular specific memory. Question 20, last one here. Learned helplessness equals an external locus of control. In other words, I don't have autonomy. I'm not empowered. Bad things happen to me, and I don't have the power to protect myself, to keep myself safe. So there you have it. There's the quiz questions for session 2. Thank you for your attention.